welcome everyone. My name is Amy Castles, and tonight I am here to talk about migraines and share some of my own personal testimony, as well as we have a guest that's going to share her success and her testimony. We are going to go over a little bit about Migraines 101. If you are savvy in migraines, you probably know all this information, but if you are watching this Zoom to help others, then this is great information for you to know. There are about 40 million people in the USA alone that suffer from migraines, which boils down to about 1 in 4 in a household, which is just wild to me. It's not just a headache, and they can affect anyone. We hear it is mostly women, but it can affect anyone, and it can go from children up until adults. It's definitely misunderstood. It's misdiagnosed. It is a group of symptoms of pain in your head that's so severe. You have light and sound sensitivity, often accompanied by nausea and vomiting, brain fog, dizziness, diarrhea, blood pressure spikes, metal taste in your mouth, excessive yawning, voice changes, sinus congestion. It can be a few of these symptoms at once, or it can be all of them together. Every trigger is different and how it presents itself in a migraine. And some migraines have more symptoms than others. It depends on the type of the migraine, but we all know many of these feelings. So migraines can occur anywhere in your head. After 35 years, I started to memorize what trigger would trigger the migraine in a certain area of my body, in my head. So sometimes I just knew that if I had a migraine on the left side of my face, then it was a hormonal imbalance migraine. If I had a migraine in the prefrontal cortex, right between my eyes, that one was caused by sugar, or that maybe I had something too sweet before bed, like even if it was just bread, or if it was even a few grapes. I mean, I just knew over the years that I cannot eat carbohydrates before bed that would break down and spike my blood sugar. And in the same way, I also knew that if I were to have a high amount of stress, then stress could also, for some reason, stress then spikes your blood sugar. And I would feel that in the morning, just right in the center of my forehead. So your pain and your trigger, they're matched. Okay, there's a lot of comorbidities with migraines. It is very, very complex, and it's not just about the pain that you get, but there's some correlations that are taking place that they're finding. And psychologically, we're seeing that depression is higher with people with migraines. If you have less than 14 migraines per month, there's a 20% increase chance of depression. But if you have more than 15, it's around 30 to 50% chance of depression. And I can completely understand that because thankfully, with the way that I've lived my life, what brought me into health and wellness anyway, is because of the migraines. That's why I'm here. That is why I jumped into being a health coach, going to school for health education, exercise physiology. It's because I was so obsessed with the lifestyle that I was living in order to prevent migraines. And that started for me in 2004 or so. Thankfully, I did not have that deep depression like many get because I was doing a lot already to reduce the migraines. But I will say, if I had a migraine, let's say 3 days in a row, which is most of the people who are having migraines, it would start to really affect me psychologically, and my well-being was very much affected. Anxiety, now I will say anxiety was definitely higher for me because I always had to live this life preventing migraines, and nobody really understood that. I didn't notice as much whenever I'm at home in my safe place, but you put me on an airplane around halfway around the world. I don't know where I'm going to sleep or how comfortable the beds are going to be or what we're going to eat or what the air quality is going to be. Now the anxiety starts to kick in. PTSD is big with people with migraines because you go through life feeling that you're in control, and then all of a sudden you're just knocked down and you have absolutely zero control. So it really does affect people. You come out of a migraine going, what just happened? And you realize that you're just powerless. And it's a very humbling feeling. Suicide, um, thankfully, I hadn't been there, but many people are. Where they see medical conditions that are comorbidities with migraines, asthma, allergies, irritable bowel syndrome. I mean, I will say, if you have a migraine that's so severe, your bowels, they're just completely letting go. Everything is affected from your whole digestive tract. Anything that's in your stomach, it's coming up. Anything that's in your bowels, it's coming out the other way. So, COPD, fibromyalgia, obesity, I mean, all these things. And then, of course, the neurological effects with the epilepsy, which is why they use a lot of anti-seizure medicines for migraines, which those have a massive effect on your overall well-being as well. I've been there, done that, unfortunately. Restless leg syndrome, stroke, tics, like multiple sclerosis. I have a couple of friends with MS, and both of them have severe migraines as well. It's not fun. This is a timeline of a migraine attack. So let's say you have this vitality stage where you're clear thinking, you're energetic, you've got a fit body, you're well rested. This is where I lived for a long time. But living the same lifestyle as I got older, I was constantly in the inflammation stage, regardless of the lifestyle that I lived to prevent the migraines, which we'll talk about it in a little bit. Many people are living in that inflammation stage. And then they start to feel the migraine just a little bit in that prodrome stage. That's where they start getting a little irritable. They don't even realize a lot of times that it's happening, but they're on the verge of a migraine. And this is where maybe you might hear their voice start to change, or maybe they start yawning, or they start getting tired and they can't think really clear, maybe just a little bit nauseous. This is that stage where it can go either way. Aura then starts to come on. This is where, they start blacking out. They start seeing speckles of light blacking out. For me, thankfully that did not happen, but I would get very sensitive to light. Okay, we got to turn off the light. I can't, like, it's too bright. Just that feeling on my tongue. If you've had migraines, you know what that is. Then it's the full blown migraine attack. And when you're in it, it is taking you absolutely down. It's throbbing, it's drilling. It sometimes would feel as if somebody was taking a hammer and hammering on my head. It was it was bad. And it's not, you can see, I mean, PTSD is real with it. Nasal congestion, that can happen. If you have a deviated septum, which I can talk about here in just a little bit, you'll notice that one side is very, very congested with a migraine. And that's a whole topic in itself. Your neck is so stiff. And then you hit that peak. And, pretty much what most people are doing is they go and rest at that point. And then they can start coming back down. This is the post-drome stage. This is where they can't, it's hard to concentrate. You're coming out of just spinning. Life is still continuing on, but you're coming out of the bedroom. You don't have the hydration anymore. Your blood sugar's probably low. You're malnourished at this point. You haven't eaten your protein. You have a to-do list that just completely stacked up. And this can throw you back into a migraine, which is kind of what would happen to me. I would kind of go back and forth. It was really imperative to take care of my body in that post-drome stage. This is what a migraine looks like. This is a horrible picture of me. But as you can see, I wasn't crying at all. It's just that the pain was so bad in my face that my eyes were super puffy. And you can see with my mouth, like, it hurts to, like, it hurt to swallow. My nose looked huge. My face was red. You can see on this picture on the right where I'm kind of turned to the side. You can see it a little bit. I can see it, but wherever the migraine was, I would see red. So it would just be, the inflammation and the heat. It's a lot of heat in that area. There's a lot of things that you can do for a migraine just for acute care. Sleep is number one, of course. Being in a dark room, eye mask, a hot and cold shower. Sometimes I would pretty much, when I would be knocked out, I would get in the shower, I would put the hot water on my head, but then I would really quick change it to cold water and then I would just alternate it. Sometimes that would help with blood flow and sometimes not, but a lot of times I would get in there and then I'd go lay back down. An ice pack, that was always something I would ask for at 3 o'clock in the morning when those migraines would hit. Chiropractic was always great for me. If I had a full-blown migraine and it was coming from my neck, then I would go to the chiropractor and they would work it out. And it would take a good 30 minutes for them to work it out. And then I would do the adjustment. So I wouldn't ever recommend going to a chiropractor where they just snap, crackle, and pop and then you leave. They need to work on you. They need to do different techniques to release the muscle. Some people like their feet in hot water. Caffeine can help depending on the type of caffeine. You don't want to put too much acidity in your body. You don't want to drink a bunch of sugar because then that can just send you into a migraine if your blood sugar spikes. So caffeine is hit or miss, but you got to know the right kind of caffeine. An IV drip, I would always do a migraine drip, IV drip, and that would help me if I had the severe migraines, and it would help with hydration too. Because a lot of times you're getting dehydrated and then it would trigger into a secondary type of migraine. So you started out with a migraine for one reason, but because you weren't able to take care of yourself, now you're dehydrated. Now your blood sugar dropped and you have a potential reason for another migraine, which is a lot of the cycle that people get in. Acupuncture, prescription medications. There was a prescription med that I was taking, and it was actually called Topamax. It is an anti-seizure medication that is very, very strong. One of the side effects is how it affects your mood, and it definitely affected my mood. I lost he's now my husband. I got him back. But at the time, because I was a crazy lunatic on that medication, he broke up with me. But don't you worry, I got him back because that medication also makes you lose weight. So I looked really good and I got him back. Okay, that was like 23 years ago. All right, antihistamines help, but sorry, let me go back to that medication. If I ever missed my dose, I would get the worst migraine the next day. Antihistamines, that sometimes helps people too. Okay, so let's go on managing your migraines with lifestyle. It is very important that you know your triggers. It is really important to know your triggers. If you don't know your triggers, how can you live a life that helps you prevent migraines? So it's really important to know your triggers. Stress management is number one. Your body's ability to deal with stress is unique to you, and everybody is different. You may be stressing about something that you have no idea that it could be a perceived threat, but your body thinks that it's a tiger coming at you. Consistent sleep, staying consistent with your sleep. It's really hard on your body to go in and out. And sometimes, when we travel overseas, we would always have to go a day early just so that I could have a migraine and be puking in the hotel bathroom. We had to do that every single time I traveled internationally. And it's because of the sleep disturbance and also the airplane and the pressure. Hormone balance, that is super important. If your body does not adapt very well to stressors, then when there's a shift in your hormone balance, then your body reacts to that. Alcohol consumption, that is a huge trigger. Thankfully I quit drinking when I was 21 because I realized how bad they affected my migraines. I know that's kind of my joke, by the way. I quit drinking when I was 21. You get it? You get it? Okay. Caffeine limitations and your sources. I can drink caffeine from one source and I do great with it. But if I were to drink caffeine from, say, coffee, because of the acidic residue that it leaves on my body, then that would actually trigger a migraine. So if you get a migraine unless you drink your coffee, then you're probably withdrawing from the coffee. So it really should be where you don't have a headache, or you're able to use the caffeine to help you. You don't want to be withdrawing and then have to use it. Okay. Weather changes. When the barometric pressure drops, if you're living in that state of inflammation, the weather change will affect you. And that's why, so when people say, I'm really affected by the weather, and it doesn't matter if it's migraines or if it's arthritis or anything else, if they're affected by the weather change, your body is inflamed. Period. It's just how it is. So if you reduce that inflammation, then you won't even know that the weather is changing. Inflammatory and high histamine foods. Many foods are they cause a lot of inflammation. And that is all of our processed foods. I mean, the way that we eat our processed grains is not the way it should be eaten. If you're going to have bread, the only way that I would buy store-bought bread is if it was Ezekiel bread. Otherwise, I'm going to mill it myself and then I'm going to turn it into sourdough bread. And then I'm going to make sure that I don't eat it after a certain hour so that I don't have high blood sugar while I'm sleeping. Raw milk, raw cheeses, keep staying away from the processed packaged foods, the preservatives, the sweeteners, the colors, the dyes. They are stressful on your body. I don't want to come here and say, don't do this and don't do that, don't do this and don't do that. What I'd like to say is live like you lived on an island and you had access to every fruit and vegetable and protein sources and fresh fats and fish and grain that you wanted. Imagine that. How would you eat? You wouldn't be eating all the protein bars or the fast foods because it wouldn't be available. You would have to eat fresh. Okay, high histamine foods. Yeah, some people have a histamine intolerance, and their body's ability to handle the histamines that some foods have is a little bit less than others. So that may mean that you might not be able to do things like kombucha or vinegars, alcohol. Those are higher in histamines. Now, I will say, since being on the peptides, I am able to handle high histamine foods so much better. My body's response to those high histamine foods, so much better. Dehydration, keeping your body hydrated is super important. And I'm not talking about Ozarka water, because if you're just drinking Ozarka water every single day, you're probably super dehydrated. Really, everybody should be having, at minimum, a reverse osmosis water machine that remineralizes. So having your minerals and electrolytes is super important. The light that you are exposed to, natural light is best. We want to try to stay away from all the fluorescent lights and all the artificial flickering lights. Smells are another big deal, keeping candles and things like that, fragrances out of your home is super important. Medication overuse. If you're using too much medicine, it can trigger, unfortunately, some migraines. Even your mattress and your pillow are important. Chiropractic care, making sure that you stay well in your chiropractic. Okay, so I've named a lot of things. I would be very irresponsible if I told you just take this peptide and now it's going to fix all your problems. The reality is that you don't know which one it's going to help. It's very important just for health benefits alone to be managing a lifestyle that prevents migraines, because all of these things that I listed are what we should really be doing anyway. And if you're like me and you're doing all these things well, but there's still some of those migraines that are affecting you, that's where the peptides come in and they make a drastic change. Okay, so let's go on right here. If you would like to scan this migraine tracker app, this is really, really cool. You can keep a track on your migraines and mark them with their triggers. You can mark them with the time that you have it. It is very useful, very helpful, great for testimony too. So screenshot this or take a picture with your phone. Okay, my migraine journey. For many, many years, I've lived the lifestyle. I ate clean. I always concentrate on, I've got four types of water filtration systems in my home. We're total water snobs here. My sleep is good. I try to keep my stress under control. I've got the supplementation. I mean, you name it. I was doing that lifestyle. I even went and had my breast implants removed just to possibly take out any potential inflammatory trigger and reduce some of the toxic load on my body. I had a partial hysterectomy to help balance my hormones. It did help. It did help. I've been on bioidentical hormone replacement therapy from the time I was 23 years old because of migraines. It's just, it brought me here. And it did help. I will say it did help. Sinus surgery. I had sinus surgery. It helped, but it didn't remove them. So as this chart, as you see, the lifestyle is your foundation. And then I did these extra things to bring me closer and closer to a completely eliminated migraine lifestyle. And it wasn't until I got the tirzepatide that I had full on migraine relief. So remember this chart. I was constantly living in a stage of inflammation, constantly. And at any moment, if there was some sort of physiological change in my body, then it would send me into the prodome. The idea is that we go to a vitality stage, one where we are clear thinking. We can see the bones in our wrists. We don't have the swelling in our hands. We wake up with a clear mind and we actually can focus. That is where we want to be. On the left is February of 2025. This is me living the healthy lifestyle. And here is 7 months free of a migraine. Now, I'm still healthy, but I was carrying a lot of inflammation. Now, it was only 5 pounds. I've only lost 5 pounds, but I take a very, very small dose. 5 pounds, and that's the difference that it made. You can see it in my face. It was in my body, yes, but it was more in my face, which tells me that's closer to my head. So my head was inflamed. Did I have 5 pounds in my head? Okay, no. But I mean, I could probably show you some other areas where that 5 pounds of inflammation was. It's a big difference in how I feel and how I think. And we're 7 months free of a migraine, which is amazing. So we're going to go into what are peptides. Peptides are short chains of amino acids that act as biological messengers in the body. So basically, it's like they're little text messages to different areas of your body and different receptor sites. We all make peptides. And when we were younger, we made a lot of them and they worked really well for us. But as we get older, we don't have the same amount of peptides being produced in our body. And from recent information that I've learned is that some people make more peptides than others. And for me, it's very possible that I just never made a lot of the GLP, GIP peptide. And that is possible for whatever reason. And I mean, we all live in different places. We all have a different lifestyle, and we've all been exposed to different chemicals and toxins in our life. And we're all different genetics. So there are peptides that we've been using for a really long time in the medical field. Excuse me, I say we, I should say they, because I am not a doctor or a physician. I'm just a health and wellness educator that's very passionate about sharing this information. They have been using peptides in the medical field for a very long time. Insulin is a peptide, and it is a very useful peptide that many people need for their daily function. Okay, there are different peptide categories. There's weight loss peptides, longevity peptides, sexual health peptides, and peptides for cognitive support. One of the things that Dr. Villarreal has stated many times is that it's really been a shame that they've put peptides or like GLPs in just the weight loss category because they're seeing so many other effects. People got on a GLP possibly for weight loss or inflammation, but then they're seeing all these other things just completely disappear. When we're talking about GLPs, we're talking about GLP-1 and then GLP-1 slash GIP. So the difference is you've probably heard of semaglutide as a GLP-1, and then GLP-1 slash GIP is a tirzepatide. So these are two different type of peptides that work very similarly in the body, but GLP-1 slash GIP, the tirzepatide, is a dual action treatment that targets both the glucose dependent insulinotropic polypeptide, the GIP, and the glucagon-like peptide, GLP-1 receptors. So this tirzepatide is working as a dual agonist in the body, working on multiple receptor sites. What a lot of people notice with the tirzepatide versus the semaglutide is that they can take less and they have less of the side effects. So the less of the side effects being things like what you hear with the nausea or possible constipation. However, for others, they still have wonderful results and they don't have all those side effects. But the majority from what we're hearing is that people can take less of the tirzepatide and still get the same or the better results for them, where they're having the fat metabolism and the energy balance and better metabolic function and the reduced inflammation. You can use the support on the website with an AI function to help you determine what would be best for you. You can add additives to your peptide compound. You can add L-carnitine, which is really great for fat metabolism. You can add glycine, which is very calming for your body. It's also a good muscle preservation and good for weight management as well, inflammation, oxidative stress. And of course, the B12, which is an essential vitamin that supports your red cell production and your nervous system function. B12 is does everybody remember the Krebs cycle in school? The Krebs cycle is every single cell is going through that Krebs cycle in our body where it's metabolizing your methylating. So this B12 is actually a methylated B12, which is better for all of us to digest and be able to process, because about 40% of the population cannot even take that cyanocobalamin. And most people should not take cyanocobalamin, but most people, 40% of the population is not methylating properly, is what I should say. Okay. NAD is not a peptide, actually. It's a coenzyme, and it plays a role in your cellular health and fundamental cellular functions, including your DNA repair and energy metabolism and cellular stress adaptation. So, if you're the type that maybe you're already on tirzepatide or you're already on a GLP and you're seeing some results, but you would like some more in the cognitive function area, then NAD may be really, really great for you. My husband loves NAD. When we first started using it, we actually went to South Carolina to go fly to a longevity specialist there. He had debilitating migraines. He started NAD, which is why I went there, and I did multiple infusions of NAD. When we came back home, then we found out that Dr. Villarreal in Conroe does injections of NAD infusions in an IV. So my husband would have to go there every single month and do it. Well, now that we have LEMD, he just orders the NAD to the house and gives himself an injection every single day. Most people are going to notice really great energy, and they're going to notice just that their body's ability to deal with stress. I haven't had to go to this one because the tirzepatide works so well, but I can tell you that many people do very well with this one because stress is such a big deal for people with migraines. B12, we talked about B12, and you can get it by itself, but you can also get it compounded. Your B12 levels are super important. If your B12 levels are low, you're going to notice that. You're going to notice that in your mood. You're going to notice that in your blood. You're going to notice that in your cognitive function. So I just wanted to put this on here because it is something good to have. And just know that it really helps with your cognitive health and nerve protection, which your nerve and your cognitive health have a lot to do with migraines. Glutathione, I put this on here because this is also really great for supporting detoxification. Most people who are having migraines, they have a really challenging time detoxing. It's like I said before, 40% of the population does not methylate properly, and that's because genetically, there's something called the MTHFR gene mutation. It's methyl tetrahydrofolate reductase. That particular gene, if it is blocked or altered, it's called a genetic SNP, then your body just doesn't detox well. And I'm one of those. And unfortunately, if I drink alcohol, for example, then it sits in me and body. It's like my body can't even process it. Well, there's a lot of people like that. And toxins and nutrients, they just kind of still float around, including heavy metals. So glutathione is a really, really great antioxidant, and it protects your body from free radical damage. And what I like is that it makes your skin glow. So this is the one that BPC 157 TB 500 is one that I was going to go to if I could not get results from the GLP. But this one is so amazing for inflammation and for musculoskeletal tissues. And many of my migraines would be just from a hard workout. And I would really try hard to not do a workout that would inflame me. But how do you get results in the gym if you can't progressively overload? And that was all part of the challenge with me. And BPC 157 with TB 500 was one that I was going to go to if the tirzepatide didn't work. This one is also really great for gut health and for the gastrointestinal lining, which really has a lot to do with migraines as well. So, again, this one is amazing, and it's also one to go to and look into. Why LEMD? LEMD is a telehealth platform. They are a company that provides peptides that are medically supervised to go straight to the customer's door, the patient's door. And that is so empowering. So, someone like me who's not in the medical field, I can't prescribe my own peptides, to be able to go onto the website and look over what is offered, to be able to do my own research and take empowerment for my own health, and be able to go on there and know that I'm going to be able to fill out an intake form and ask questions to a telehealth provider. It is such a wonderful, empowering thing for me as just the normal, everyday person. And I'm going to get a prescription that's personalized for me. And I'm also going to get pharmaceutical grade peptides. These peptides are only offered by prescription only, and they are filled through a 503A compounding pharmacy. And that means that those compounding pharmacies are licensed. They have all the registrations through the Texas, let's see if I say this right, Pharmacological Board, because the pharmacy is in Texas. So you're going to get the highest quality. One of the reasons why my doctor loves LEMD is because he would have to write the prescription and send it and find the right pharmacy that would compound the whatever peptide he wanted. But then he would notice that sometimes he would get a good vial and then sometimes he wouldn't. And his patients would tell him, they'd say, hey, I had great results on the peptide when you gave it to me at first, but all of a sudden it was like that second month that I got, it just didn't work. And then he would prescribe it to him again, and then maybe with a different pharmacy, and then all of a sudden it worked again. So testing is super duper important. And you can guarantee that our partner compounding pharmacy, Clover X, is going to test them and retest them, that they're testing them when they come. They test them before they go out. They have a lot number and a batch number, which is very important. So you're going to get reconstituted vials. You do not have to be at home having a chemistry class like you're going to see some people getting from Billy out on the street. I'm sorry if your name's Billy, I'm not picking on you. But if you're having if you're getting your peptides out on the street or in the gray market, I mean, you're having to mix all that up at yourself and just hope that your powder is something of substance and clean. So that is super important. All right. LEMD is leading the way in the first company to offer truly personalized prescription longevity microdose options for you. They're personalized. You can have unlimited messaging with a telehealth provider. And then you're going to have community support. People are actually pouring into the conversations that are taking place in the Facebook group. So there's a Facebook group with pretty much everyone who is on a peptide within LEMD, and everybody is willing to offer help. So that is truly amazing. Okay, so my guest, welcome Ambra McGuinn.
Thank you, Amy, for having me tonight. Okay, so I'm Ambra, and Amy and I met in Texas, and we were talking about migraines and actually have an incredible migraine story testimony. I have struggled with chronic migraines since I was in middle school. I mean, I would come home from school, cheerleading practice, and I would like have to take medicine that would knock me out and just lights off, cold rag, I would be in the bed. Like it was really bad. And that followed through to my high school years and when I was in college and even into, my 30s. Now I'm 42. So I've always gone to a neurologist and taken preventative medicine, abortive medicine, like quarterly injections, all these things, and I would still have migraines. And so when I started my wellness journey a little over a year and a half ago, I started with the GLP-1 GIP, which is trizepatide. And I noticed that my migraines were better and I was not getting migraines as often. And so I was excited about that. I mean, I was still getting them, but they weren't as frequent. And so, I talked to my neurologist and she said, absolutely, it's, helping with the inflammation. There's, lots of things that the GLPs are treating or helping with. And so, um, I was very excited about that. Well, I come from the healthcare world and I worked in healthcare for 17 plus years before doing Ellie. And I had a lot of my friends that really know peptides, understand peptides, and they said, you need to try glutathione. And I'm going to be honest with you, I was actually kind of scared because everybody was like, oh, that one hurts. Like there's so much in there. And so I just put it off and I didn't order for a long time. Well, I've now been on glutathione for, gosh, about 9 months. And I am happy to tell you guys that ever since I've started glutathione, I've not had one migraine, not one migraine. And I mean, like, if you know me and if you struggle with migraines, like that is unheard of. And the fact that is, I haven't even had like a slight migraine, even to the point where I knew, like, I would get migraines if I was stressed or if I was sleep deprived. And I remember when we traveled to, gosh, where do we go? Punta Cana for our Ellie event or Ellie trip. And we were so tired. I mean, we were on a plane and we barely had any sleep. I was like, oh, I'm going to get a migraine. No doubt I will have one when I get home. I never got a migraine. And so I am here to tell you that these peptides are changing the game for people. And I'm not saying that you add in glutathione and you'll never have another migraine. No, but I am telling you that's what it did for me, and that's what it has continued to do. And so, um, with it detoxing and cleansing out all of the bad things, I mean, I'm just so grateful that I decided to use it and I've not cycled off of it. I know some people say that you should cycle on and off certain peptides. The doctors are fine with me taking glutathione or, and not coming off of it. My neurologist is fine with that. And so that is one that I will not run out of. And I just am so grateful every single day that I just show up better for myself, for my kids, for my family. And that's my migraine story.
I love it. Thank you so much. I vaguely remember it was so loud when I met you, but I vaguely remember you telling me that it was glutathione. And it makes sense. And I think that's where it's important to, look at some of these options and say, where are my migraine triggers and what am I doing to prevent them and where's a good place for me to start? And it may be something that you might have to layer. For me, I have been free from migraines just from the tirzepatide, but why not also do a glutathione on that? Now you're selling me on glutathione. Glutathione helps you detox. So have there been things that you do like for food, drink, or being around perfume fragrances, have there been moments where you're like, oh, I would have gotten a migraine from that for sure?
Yes, yes, like especially fragrances, like any little like perfume, it would just trigger it. I mean, crazy. And no, I'm just like blown away. I mean, I even get to wear more perfume myself now, which is kind of wild. I
Wow.
used to like only have two that I could choose from, and now I'm like, I've got all kinds of different ones, which is
Hmm.
just crazy to say out loud. But yeah, yeah.
Wow. And how many times a week do you take your glutathione, if you don't mind me asking?
No, I don't mind at all. So I take it twice a week, and it is 100 units. But what I do, you're supposed to do 50 on each side. I do 100. I pull up my syringe to 100, and the doctor will give you all the instructions. But I have to do it like in a fatty part. So like my stomach, yes, there's a little bit of fat there, but that wasn't enough. So I do it more towards like my love handles, and I really do not feel it, and it's not bad. So I
Good.
always like to tell people because they're like, oh, is it like, I don't know if I can handle that much, but I promise you it is not bad at all.
Now, have you told your neurologist
Yeah.
yet?
Yeah.
And are they happy? Are they
100%. Yeah.
That's great. Good.
Yeah, I have to go every 3 months to stay with your neurologist. You have to go every 3 months. And the past two times, the first question they ask is, well, how many migraines have you had in the past 30 days? And I'm like, zero, which is crazy. And I mean, she knew like the trizepatide was helping a ton with my migraines, but I was still having them. And so when I started the glutathione, I mean, now it's, like I said, 9 months. And she's just like, keep doing it, keep doing it.
Yeah.
So,
Okay. And whenever you had a hormonal shift,
yep.
would you get a migraine before?
Oh, yes.
And
Like terrible.
so have you changed anything with hormones? Have you supplemented hormones
No,
at all?
no,
So
I have not.
so your hormonal shift migraines, did they get better or were they the same with the tirzepatide?
They were better with trizepatide for
They
sure.
were
Yeah.
they were better, but still kind of there.
Still kind of there. Yeah.
And then
Hmm.
you added in the glutathione and then the shift,
Nothing.
there's nothing. Okay. All
Yep.
right. Good to know.
Yep. Now I have a few, like my mom, she has chronic migraines, and I got her like she got a round of glutathione, and she said like it was so incredible. She still did get a couple of migraines, but she's like, this stuff is the real deal. Like she absolutely loved it.
Awesome.
And I've got other girlfriends that have struggled with migraines, and it's helped them a ton. But for me, for whatever reason, I've not had one. And so I'm just very happy about that.
Well, thank you so much. And I know you've had a big gathering at your house, so I am so thankful. She literally has house guests downstairs, so I'm really appreciative of you coming on here and sharing your
You're
story.
so
So thank you
welcome.
so much. Well, you
You're
have a
very
good
welcome.
night, and
Thanks,
thank
y'all.
you.
You're welcome. Have a good night, y'all.
So I'm going to address the chat. There is a question in the chat, and the first question is from Melissa. So when I first started tirzepatide, I am the type of person that's like, I don't read instructions and I just kind of go for it. So I took the full dose of the full dose of the initial 2.5 milligrams. And for me, it lowered my blood sugar too much. And then it actually sent me into a headache really bad. It wasn't a migraine, but it was a really bad low blood sugar headache. So I backed off completely. And then I went way down, like went back to just 10 units. And then once I did the 10 units, I was good. I was like, okay, I can do this. I can do this. And then I tried to go up in my units to 15, but then it kind of dropped my blood sugar too much. And then it kind of gave me a headache, but not a migraine. But I definitely felt that my blood sugar was low and I also checked my blood sugar and it was low. So I had to go back to the 10 units and then I've slowly, tiny progressed up. I used to have low blood sugar headaches or high blood sugar headaches. The funny thing is that now I don't have to have the anxiety of not having food. It has been the most empowering thing to not have to constantly think about food. And there was anxiety around it because not only did I have to have food, I had to have a certain kind of food. So being very high maintenance. I mean, my husband, he's very patient. So the terzepatide helped me. Now I can go a long time without food, which I don't go longer than about 3 hours, but that's only because I'm into health and fitness. So I want to make sure I'm getting my protein in and all that. So used to though, I would not be able to go longer than about 2 hours and I would feel my blood sugar drop. So the terzepatide, as long as I find that sweet spot, then I can stay at that dose and my blood sugar won't drop too low and it will never get too high either. So I hope that answers your question. Start slow, go low, and you can talk with your provider and talk to them about how you can go up. But even a difference of 10 units versus 12 units, I will say it's powerful. It makes a difference. What you can do next. Today, we talked about metabolic support, longevity support, sexual wellness. Well, we didn't talk about sexual wellness, but you know that's there. Just so you know, when you get migraine free, you're going to want to come here for that sexual wellness. You know what I'm saying? Okay. Imagine what 90 days could look like. Many of our peptides come or 2 or 3 months supplies. Your body really needs 90 days to go through full physiological changes. So be comfortable with giving it 90 days to find your relationship with the peptide because it's a relationship. You're getting to know the peptide and how it's reacting in your body and how your body is responding to it. And it does take time to get used to it. And now I know, oh, that's my terzepatide kicking in. I know when it kicks in. And I also kind of know when it's starting to wear off. You're going to have more energy. The more that your body gets healed, you're going to have more energy. You're going to have better body composition. Even though I don't take a high dose to try and lose weight, a higher dose to lose weight, I still am getting in better shape. And you know why? It's because I'm not down with a migraine a few times a month. I'm actually able to stay consistent in my workouts. I'm able to lift heavier because I don't have to be worried about getting so inflamed in my neck that it triggers a migraine and have better recovery and performance. If you would like to order peptides or you want to explore them more, I encourage you to talk to the person who invited you on this call tonight or today or this recording and reach out to them and they can help you get started. Thank you so much again for watching, and we hope to talk to you soon. And I'm wishing you well on your migraine journey.